When does that glass of wine with dinner turn into a drinking problem? And when does that transition into addiction? So today I will tell you what to watch out for according to the science. So drinking is weirdly normalized. Like, I get asked more often why I'm not drinking than why I am drinking. Now think about that in terms of something like acid. Like, nobody's asking somebody why they aren't using acid. So why is it so okay for people to ask people why they're not drinking? Like, it's always fascinating to me as a drug scientist which drugs are more normalized and which ones there are stigmas against. But in the case of alcohol, since it is so normalized, it's really hard to tell what level of drinking is normal. And what we see is that people who underestimate the amount that other people are drinking, they are less likely to become addicted. And if you overestimate the amount that other people are drinking, you are more likely to have an alcohol problem. And this is where the language that you're using really matters. And so today I'm going to talk about like the different levels of drinking. So like what constitutes low risk drinking, what constitutes like high risk drinking, and then what's that final step into addiction? So let's start with kind of the idea of more low risk drinking. Now, weirdly, we've changed this definition over time because now we're at the point in which we think that basically like no alcohol is what's best for you. If you look at the actual recommendations from across the world, they're basically like, yeah, we used to think that a little level of alcohol was good. Like a glass of wine was supposedly heart healthy. And now we're like, yeah, no, actually pretty much any level of alcohol is associated with some sort of harm. But the thing is that we know saying that no alcohol is best for you, we know that that's not going to go over well. So like we've tried prohibition in the United States. That was an utter failure. We have tried telling people to not use drugs in the DARE program, also an utter failure. So just telling people that they should not drink is not going to work. And in fact, if you have people who have more kind of problematic drinking, telling them to go down to zero is going to be very hard for some people. So we need to have this definition of like low risk. Like maybe if you're using below this level, that's kind of an acceptable level. So the NHS has actually defined low risk drinking, and they say that like anything at 14 units or less per week is okay-ish. Like it'd be better if you didn't drink, but that is probably not as high risk as other levels. So you might be nodding along and being like, yeah, 14 units, that doesn't sound great. What actually is a unit though? So a unit is about 10 mils of a drink. So what they're saying is that low risk drinking is about like a glass of beer or a glass of wine per day. Like if you are at that or below, that's considered typically low risk drinking. Now, again, this is a group of people who are like, no, but low risk is not actually low risk. So even if you are below a drink a day, this could still cause harm. And that is technically true. There's an increased risk for things like cancers associated with basically any use of alcohol. I've done an entire video on this. So then there's another group that's like, okay, we don't actually really care about the low risk group. What we care about is the high risk group. And so maybe you should just care about the measure that says that somebody is more likely to be at high risk for things like addiction, but also for long-term harm. And so this concept of a high risk group is typically 35 units for women per week or 50 units per men per week. So the high risk group is basically like double the low risk group for women. So if you're having 1 glass of wine per day, when you start to get to 2 or more glasses of wine per day, that might be high risk drinking. But the thing is that we don't see that this is actually fully linked to addiction. So people who are in this high risk group cannot be addicted to alcohol. So you wouldn't consider them as having an alcohol use disorder because that means something else entirely. So you have low risk, then you have high risk, which might be more likely to become addicted and more likely to have harm. But then you actually have the addiction criteria. The addiction criteria is more of like the behaviors associated with it versus like the actual amount that you're drinking. And so there's 4 main criteria for this. This feels very deja vu because I just taught this to probation officers yesterday. Like, what is my life? But so the 4 main criteria are things like impaired control. You have cravings. You have physical dependence. So this is the idea that you develop tolerance. You need to drink more and more to feel drunk. And then when you stop drinking, you have withdrawal, which in this case is fatal. So if you are a long-term drinker, do not just quit out of nowhere. Definitely talk with your doctor. You have that physical dependence. Then you have things like social impairment. So these are things like maybe you're hungover at work and this is making you not do so well at your job. Maybe your significant other is disliking your amount of drinking. I am currently in the middle of a watch of Summer House and I'm on the final season. And so this idea that like Amanda does not like Kyle's drinking, that is social impairment. Sorry, I perpetually use reality television show plot lines as examples of things, but in this case, it works perfectly. And then you have things like risky use. So you are drinking while driving, for example. And then none of those things are taking into account this idea of binge drinking. So binge drinking is for men having 4 or more drinks in a 2-hour session, and for women having 5 or more drinks in a 2-hour session. Now, what constitutes a drink? Again, this is up to everybody's definition. But in general, having a large amount of drinks in a small amount of time is considered binge drinking. People are suggesting that we change the term from binge drinking to heavy episodic drinking to show that it's not just like this one-time thing, but you're doing this kind of consistently. And so if you are binge drinking consistently, we see that this is linked to all sorts of problematic things, including addiction long-term, but also just like injuries. Injuries, accidents, terrible mistakes. Like, I don't know, I knew somebody in college who flooded their entire house, including their roommate's house, because they fell asleep in the shower. Like, problematic episodic drinking is a thing that is harmful too. So how do you know when drinking becomes problematic drinking, and how do you know when that turns into addiction? Well, it depends on like the actual behaviors that you're in. There's not like a set amount of this person is drinking every night, so they are for sure addicted. But there's also not a set amount of like this person only drank 2 nights this week, so they are also not addicted. Like, you have to think about the criteria for addiction. You have to think about things like, is this actually a problem in my everyday life? Is this a thing that I could quit? Would I have cravings for it? People ask the question a lot of like, yeah, but I could quit it. And that's people say all the time that they're like, yeah, I could definitely quit, but could you like be a little bit more real with yourself for these? And if you see that your behavior is going from lower risk to higher risk to maybe bordering on that addiction level, like start to think about how you can keep it under control. Find resources that might help with this. Talk to somebody you know that might have quit and ask them what they do. If you're seeing these signs and symptoms in somebody else, like, your job is not to be the person that forces them to quit. People need to quit on their own. And sometimes that's just being that social support that they need to say, hey, I'm here for you. This is what you want to do. I will support you in that matter. But also, you are probably not an addiction specialist, so don't feel like you are the person to give them advice on what they should be doing. That is for their doctors, that is for their therapists, that is for their addiction specialists. Because we live in this world in which it's really hard to figure out, like, where is the point when drinking is problematic drinking? And that's something that in a lot of cases you can kind of only answer for yourself. But at least now you know the general levels to have something to base your decisions on.